the data from the 3 prospective clinical trials that were looking at the role of CAR-T as second-line therapy in patients with diffuse large B-cell lymphoma were not presented specifically in this ASH meeting 2022. I think that there was a follow-up of the Transform trial, but the major data were presented at the last ASH meeting in ASH 2021. So 2 of these 3 prospective clinical trials were positive, and they demonstrated with the population of patients that were selected for these prospective clinical trials and with the design of the prospective clinical trials that the use of CAR-T, in this case it was axi-cel and liso-cel in patients with primary refractory and early relapse diffuse large B-cell lymphoma, was able to significantly improve event-free survival in front of the standard of care, so second-line salvage treatment strategies and autologous stem cell transplantation. The positive results of these 2 prospective clinical trials have had a significant impact in the way that we are looking at treatment strategies in these 2 subgroups of patients. So, second-line treatment strategy with axi-cel and with liso-cel has already been approved by the FDA, and in fact the use of axi-cel has also already been included in version 2.0 of the NCCN guidelines to treat patients with diffuse large B-cell lymphoma. If we move to Europe, axi-cel has been approved as second-line treatment strategy by the EMA. So that was in October 2022. And there are some European countries that have already started using axi-cel as second-line treatment strategy in patients with primary refractory or early relapse diffuse large B-cell lymphoma. And if we look at the potential impact of the introduction of CAR-Ts with respect to the use of other cellular therapy strategies, so basically stem cell transplantation, what our American colleagues have already seen is that the introduction of CAR-T has already represented a significant decrease in the numbers of allogeneic stem cell transplantation, but also in the numbers of autologous stem cell transplant. If we come back to Europe, the introduction of CAR-Ts has significantly reduced the number of allogeneic stem cell transplantation and has started to reduce also the numbers of autologous stem cell transplantation in patients with diffuse large B-cell lymphoma. And I'm sure that probably in the near future, these changes in the way that we are treating patients with diffuse large B-cell lymphoma are going to be even more significant. And probably we will be able to better understand if the global population of patients with primary refractory disease and early relapse are candidates for CAR-T, or there is a small proportion of patients that can eventually be considered candidates for an autologous stem cell transplantation, also taking into consideration that CAR-T cell accessibility is not 100% around the world.